So if we look at it across the age range, kind of like when we look at with during prepubertal time, very limited amount of hypertrophication going on. Mainly because there's not a lot of what hormones? Testosterone or androgens. There is a lot of growth hormone. But growth hormone does not stimulate what cells? The satellite cells. We do have some hyperplasia going on, particularly during growth phases. Most of the muscle strength adaptations that occur prepubescently is due to neuromuscular modifications. I learn how to contract. Most everybody learns how to ride a bike when they're little. When you first learn how to ride a bike, you start with a trike, then you work to a normal bicycle with training wheels, and then you eliminate the training wheels. Some of us just went to the bike without training wheels, without any problems.
There was problems.
I didn't. What you're doing is you're learning how to direct your movement patterns. It's the same way. Anybody besides myself ever teach somebody how to kick a soccer ball or throw a ball? When you teach somebody how to kick a soccer ball or throw a ball, the first thing that they do is that they launch it either straight down into the ground, throwing a ball, or they wheel it about 500 feet above your head because they don't understand release point. They don't understand how to get my arm into the correct angle and throw correctly. When you kick, same thing. They either kick it and they wail at it and break somebody's nose, or they kick it and it goes, instead of straight, it goes how? It goes way off to the right or way off to the left. Over time, they learn how to pattern the motion so that everything works in a coordinated fashion. It's the same thing that happens when babies learn how to crawl and then walk. All of the coordinated motions that we take for granted get learned during this time. As they learn the motions, they learn how to sequentially and then asequentially recruit the muscle fiber. So they get the correct amount of muscle being recruited. The problem with that is that as I get older, any stress or cognitive involvement with the pattern disrupts the known pattern. Anybody ever watch it? Shaquille O'Neal shoot free throws? Has anybody ever watched Shaquille O'Neal shoot free throws? Would it surprise anybody that if I told you that during practice he was an 85% free throw shooter? Because he had the pattern down for shooting free throws. The problem is, as soon as he was in a game, all of a sudden there's 20,000 people in the stands, all making noise. He starts thinking about what he's about to do. Because he's trying to think about what he's doing. His pattern movement that he's laid down throughout his life gets disrupted because he's what? Overthinking about it. He's actually just thinking. Same thing happens. Everybody watch a golfer with a little tap-in putt?
Yes.
And all of a sudden, make it all the time, and what happens? He knocks it 20 feet past. Or you watch a pitcher who all of a sudden in a big game, plate, same thing happens. During puberty, not only do we have the continual remodification going on, but now we have growth that's taking place. We've had both hyperplasia during the prepubescent. Now we have hypertrophy. There's two things that happen in terms of motor coordination here. The first thing that happens is that the distal ends of the limbs become larger than the rest of the limb. The heads go from being really big to now being what? Normal size. They go from being Charlie Browns to being normal people. But their hands and their feet go puppy dog. Where the paws are really big, but the limbs are really short. Now their limbs start catching up, and they become LURPs. Uncoordinated people. They become uncoordinated people because I now have to reteach this whole thing, how to do everything that I previously learned how to do. For females, it becomes problematic, particularly for females who are athletic. Because what also happens during this time? You now have a change of angulation at the femoral acetabular joint. And what ends up happening is I have to relearn and reteach the lower extremity how to land correctly. The increase of ACL and knee injuries in females has to deal with the inability to teach the muscles how to contract appropriately to control landing force. Because all knee injuries, or I should say all knee injuries, but 99% of all knee injuries are due to deceleration injuries, where I'm trying to slow down or stop a fall. I've now gone through puberty. I've gone through my LERP phase. I've now gotten to the point where I have a maximum number of muscle fibers. I now have all of the hormones in circulation that I ever need. I can continue to build muscle throughout the body. I can continue to build muscle throughout the life. As long as I do what? Repeated overload. As a male ages, there's going to be a slow reduction of testosterone from pubertal levels, mainly because the male is no longer going through what? Puberty. So all of the advertisements that they sell guys that say, oh, your testosterone is dropping, the reason why their testosterone is dropping is because they're no longer in what? Puberty. The amount of testosterone that a male has in circulation is dependent upon how much maintenance that male has to do. You're going to have change in recruitment patterns as you age, mainly because what happens to the nervous system as you age is it goes and does that quickly. The amount that we keep is based off of the amount of overload that happens to be there based off of how much muscle I'm contracting. If all I'm asking to do is have this much contracted, how much of the muscle is going to stay healthy? That much. If all I do is ask for this much to contract, how much of the muscle is going to stay healthy? Just that much. If I ask this much to stay healthy, how much is going to stay healthy? That much. With age, as you get to adulthood, it's about recruiting from a low to a moderate to a high without only recruiting high, without only recruiting low, and without only recruiting moderate. If I don't recruit through each one of those types of force load requirements, I will have disuse atrophy to the tissues that are not being recruited. If I do not recruit through the various thresholds, I will have disuse atrophy to those fibers. Atrophy within the muscle is fiber specific. And it's based off of the continuum of the SEB principle. I have to generate enough muscle force to match overload. Once I've reached my genetic max, which almost nobody ever reaches, any overload will simply maintain the muscle. But since no one ever reaches their genetic potential, every bit of overload, even if I don't get to that 10%, is going to cause either a change in neurological recruitment, a change in biochemical functions, a change in proteins within the muscle, or a change in muscle fiber arrangement.
Why don't we?
Why don't we? Because no one trains that high.
I mean, they say a lot of athletes do.
They never train to their genetic potential. Because I have to get to and past my peak volitional contraction.
It's kind of sad.
If I have excessive disuse atrophy, the muscle itself starts to die away. Death of a muscle is referred to as sarcopenia, just like death of a bone is known as osteopenia. Sarcopenia typically leads to it's difficult to move with any speed. The fibers that are lost due to sarcopenia are the FOGs, the fast oxidative glycolytics, or the 2A fibers. You keep the 2X's. You lose the 2A's in sarcopenia. Typically, it has to do with the change of genetic sequencing. The change in genetic sequencing minimizes the amount of protein synthesis and increases the amount of protein degradation. Which means that instead of building proteins, I'm now what? Breaking proteins down. This here, particular stimulation off the FOXO gene, is dependent upon inflammatory signals. The more sedentary I become, particularly with old age, the greater amount of inflammatory signals I have because tissues are breaking down, leading to ever-increasing protein degradation. Same thing happens for people who are metabolically obese or over fat. So, if we were to look at the same pie wedge issue, we start pre-puberty. I go through puberty, I now have larger muscles, but the same volume of what? Each of those pie wedges is the same volume as what started here. I now have limited overload, disuse atrophy. I now have the same number of mononuclear domains. I don't lose mononuclear domains. I lose volume. So, this here can very easily revert back. So, as I go here, I get muscle atrophy. Since I'm not using the muscles, I'm also going to be losing what? I'm also going to be losing what? I'm also going to be losing bone, because bone has to have use to it, correct? If I don't load a bone, what happens to the bone? It atrophies away. These go hand in hand with each other. If I continue to limit the overload, because it's now very hard for me to do what I want to do, I now have sarcopenia. I've now lost the mononuclear domains. This cannot be reversed. Sarcopenia and osteopenia cannot be reversed. Atrophy can be reversed. If I break my leg, I get put into a cast, what happens to the muscles of the leg? It atrophies. It goes from this to that. I get the cast removed. I go to PT. And they usually start sticking electrodes on the muscle, because what they're trying to do is they're trying to stimulate this area to go back towards what? Towards that. They usually will stimulate the muscle, and they'll start getting range of motion throughout the articulation, so you can do what they need to do. And they'll start having you do closed chain activities and then open chain activities, all in an attempt to get this muscle here back to that size there. The faster I can get the atrophied back to the hypertrophied, the less likely I'm going to get what? Sarcopenia. In terms of functionality, and in terms of what actually happens within the tissue itself, at about 60 years of age, muscles are more susceptible to sarcopenic signals. Which means everybody's grandma and grandpa, or for some of us, our parents, need to have maximum recruitment of the muscles so as to offset what? Atrophy and what? The resulting sarcopenia. As I have more sarcopenia, more atrophying, I have an ever-increasing rate of bone mineral density loss. And what I have to remember is that with bone mineral density, the lower I start, the faster I lose. The loss of muscle and the change of bone mineral density leads to irregular loading at the articulations. The irregular loading at the articulations changes the joint space. I now have irregular loading on the ends of the bones, and I'm going to start inducing what? I'm going to start inducing what? Can I induce osteoporosis? Osteoporosis is a genetic disease where I don't lay down enough to start with, which means that as I start losing, I lose more rapidly than everybody else. Since I am irregularly loading, increasing inflammatory response within the joint, am I going to keep a smooth articulating surface? No. If I don't have a smooth articulating surface, I start developing what? Osteoarthritis. That gets coupled with changes of hydration. The changes of hydration leads to the collagen fibers binding down on themselves. Old bottle of glue. In order to get the old bottle of glue to start flowing out the nozzle, what do I have to do? I have to vigorously shake the bottle in order to get to unstick. Same thing happens here. I get the collagen kind of locking in on itself. Increased risk for tendon rupture. Because I have atrophy and sarcopenia, what's going to happen to my truncal erectors? What's going to happen to my erector spinae groups? Longissimus, the spinalis, the iliocostalis muscles. Are they going to be able to keep me upright? No. What's going to happen? I'm going to start having increased kyphosis. So I'm going to start going like this. As I start going like this, what's going to happen to my center of gravity? It's going to shift forward, right? Since it's shifting forward, what do I want to do with my base of support? I want to go wider so I become more stable. Now I'm like this. Now I want to take a step. How can I take a step? And I start developing old person shuffle. Watch an old person walk. It all starts with that, and it ends with that. The best thing you can do for an old person is get them to what? Stand up straight and what? Walk.